So today we're going to be talking about the 5 leading causes of death, and that's in the U.S. So number 1, heart disease. Heart disease is the leading cause of death for both men and women. This is the case in the U.S. and worldwide. More than half of all people who die to heart disease are men. Medical professionals use the term heart disease to describe several conditions. Many of these conditions relate to buildup of plaque in the walls of the arteries. As the plaque develops, the arteries narrow. This makes it difficult for blood to flow around the body and increases the risk of heart attack or stroke. It can also give rise to angina, arrhythmias, and heart failure. To reduce the risk of dying from heart disease, a person can protect their heart health by adopting a healthful diet and getting regular exercise. Get your exercise in, folks. Being able to recognize the symptoms of a heart attack can also help people get prompt medical treatment and potentially save their lives. 2, cancer. Cancer occurs when cells do not die at the normal points in their life cycle. If a person's body cannot control the spread of these cells, they can interfere with the essential life-sustaining systems and possibly lead to death. Everyone has some degree of risk, but for most cancers, the risk will increase with age. Some people have a higher or lower risk due to differences in exposure to carcinogens, such as from smoking or exposure to chemical pollutants. Genetic factors will play a strong role in cancer's development. Race and sex also play a role in a person's risk of developing cancer depending on the type. That said, lung cancer causes more deaths than any other cancer, both men and women. And one thing I want to mention is that if you look at your local hospitals' websites, they have events such as screenings where they have they're actually free screenings for prostate cancer, breast cancer, whatnot. So, obviously, like to say, if you catch a cancer in time, you can possibly prevent yourself from dying. So, all right. So, 3, unintentional injuries. Accidents or unintentional injuries are the third leading cause of death in the U.S. overall, and the leading cause of death for those aged 1 through 44. Possible prevention measures. Accidents are unintentional and usually unavoidable. However, there are many ways to reduce the risk of accidental injury and death. Some key components of accident prevention include focusing on road and workplace safety, such as using seatbelts. Put on your seatbelt, click it or tick it. And never driving or operating heavy machinery while under the influence of alcohol or drugs. Folks, use Uber. A DUI can cost you easily $10,000, and it can save lives. Number 4, chronic lower respiratory disease. Chronic lower respiratory disease refers to a group of lung conditions that block the airflow and cause breathing-related issues. These diseases include chronic obstructive pulmonary disease, COPD, bronchitis, emphysema, asthma. Smoking drastically increases a person's risk of developing these conditions. So stay away from the cancer sticks. Not only are they expensive, they lead you to death. 5, stroke and cerebrovascular diseases. Cerebrovascular diseases develop due to problems with the blood vessels that supply the brain. Four of the most common cerebrovascular diseases are stroke, transient ischemic attack or mini stroke, subarachnoid hemorrhage, vascular dementia. Every year, more than 795,000 people in the U.S. have a stroke. The risk of stroke varies with race, ethnicity, and age. The highest death rates from stroke in the U.S. occur in the South East. So we're going to look at some ways on how to prevent it. So basically, a stroke is a brain attack. It occurs when the blood supply to the brain becomes blocked. A stroke is a medical emergency that needs immediate medical attention. During a stroke, the brain does not receive enough oxygen or nutrients, causing brain cells to die. Stroke need to be diagnosed or treated as quickly as possible to minimize brain damage. So whenever you see somebody having a stroke, make sure you call 911. You can save that person's life. Treatment depends on the type of stroke. The most effective way to prevent strokes is through maintaining a healthy lifestyle and treating underlying conditions that could be a risk factor. So there you have it, folks. The 5 leading causes of death. And I know that I go jogging every morning, and I've been doing it for the past 3-4 years to keep myself healthy. And one thing I want to mention is that I'm working on getting medical insurance because I recently went to the ER and I had medical insurance, and one has to be prepared. You can't put a number on your health. So medical insurance is important. I'm going to get it through the Affordable Care Act, so I'm going to get it at a higher discounted price. But if you don't get it through your employer, definitely check out Affordable Care Act. Or go try to apply for Medicaid if you eligible for it. Because you can't put a price on your health, and you never know when you end up going to the hospital. And if you don't have insurance, you know it's going to cost you some money. And with increases in technology, we should be able to live longer, but it's up to one to decide. It's not like back in the days,